Welcome to Unit 4, Lesson 6. As usual, you're looking for the tasks to complete for U4L6. You can find them under assignments or on the campus homepage. Weekly calendar. Today's date is the 16th. We'll start off with our usual chat and share. Today's question's a little goofy. What's your favorite breakfast cereal? You guys haven't answered this one before, right? So imagine if there's like a cereal party happening, which hopefully will happen at some point in the distant future. What cereal would you go for? And if you really aren't like a big cereal person, then what's your other breakfast food, right? Are you a Pop-Tart person, oatmeal, steel cut oats, something like that? And if you're not a breakfast person, then I don't know. You can just share what cereal you would eat if you had to. So think about that for 20 seconds. And don't forget to say hi and check in with the person you're in room with as well. We'll come back together in 2 minutes. Rooms are open. Next on the docket, as usual, is COVID in the news and a little bit of homework review. So I was listening to news this morning and found some interesting articles, as usual, starting with Our World in Data. Seems kind of encouraging that we seem to be hitting a bit of a downward turn now compared to earlier in the month. So I'm hoping that the rest of December will look somewhat like this, but I don't know. So I guess maybe that Thanksgiving surge wasn't quite as severe as we were hoping, or expecting, but still pretty bad numbers compared to a lot of the rest of the world. But we'll see. Hopefully things improve. Really cool thing that I heard was that the FDA has now approved a very fast over-the-counter coronavirus test that you can use at home. The one requirement is that you have to download an app onto your phone that does something fancy with the test. But you can now test yourself at home, and it's kind of an interesting article if you read through it because they're very hopeful, but they're also a little worried that there's going to be a lot of false positives, and that that it's going to make people sort of like think, well, oh, I don't need to wear a mask anymore. I don't need to worry. I'll just test myself constantly, which is not really what it's meant for, right? It's more that if you start to develop some symptoms and you're worried, you can test yourself quickly at home and isolate ahead of time before then going in to seek actual medical attention. So interesting read there. And there's other companies that are also making rapid tests right now. And then a good article from Reuters just about, so you've been hearing about the rollout in England and the rollout now in the US. And so it's interesting to read about the World Health Organization, WHO's program, which they're calling COVAX, which is basically the program that's going to roll it out on a global scale with a particular focus on middle and poor income countries. And it turns out that things aren't looking good. The program's struggling from lack of funds, not surprisingly, lack of supplies. And so it might be as far as 2024 that some of these lower income countries actually start to see the vaccine, which just isn't the best situation. I mean, could have probably been, unfortunately, it's kind of predictable, but we'll see if hopefully some aid comes to this to kind of hurry it up. It's kind of interesting too that there's a big rush for glass now because you need glass vials for the storage and freezing. And so it's just interesting what resources are now suddenly being demanded. So anyways, check those articles out on your own time. Seeing 14 attempts on the homework, and they all look good. Key takeaways from this reading is that malaria is caused by a protozoa. It's not a virus, it's not a bacterium, it's a single-celled eukaryotic organism. So it's kind of unique. It's technically a parasite. It has two stages. It gets into your liver and then it gets into your blood. And once it's in the circulatory system, that's where bad things can happen. And if it gets into your brain in particular or your spine, then that's a particularly lethal version. It's the leading cause of death amongst children 5 years or younger in Africa in particular. And over time, it's one of the biggest killers of humans if you look at kind of its overall history of disease. And we do have a lot of medications for it, but a lot of them are now, we're seeing resistant strains. And what I find fascinating is that it has impacted human evolution. There is clear evidence of, especially people of African descent or people living in Africa, often lack these antigens on their blood cells or have a gene for sickle cell anemia, which is technically a genetic disease, but incidentally provides resistance to malaria. And so it has continued in the population, which is something we'll explore today. Any questions or comments on that homework assignment or on COVID in the news? Okay, next on the docket then is our short little presentation on Spanish flu. What I'm going to do right now is throw you back into your groups really quickly, give you like maybe 2 minutes to refresh your minds on the slide you made, and then we'll just kind of do a quick presentation. We'll go through each slide once we come back together. So just give me a minute to recreate the breakout rooms with your actual group. Okay, again, just take 2 minutes to, what I would do right now actually is open up that assignment. So on the tasks to complete list, we're looking at step number 3, Spanish flu jigsaw. Open up the assignment. You can find the slideshow and a link to your partners again. Breakout rooms are open. Again, just take 2 minutes to figure out who's going to share and make sure you feel comfortable with that, and we'll come back together. So I'll put 3 minutes on the clock. All right, again, I'll start us off. Spanish flu. Again, pretty deadly. 500 million people infected, 30 to 50 million dead. It was kind of overshadowed by World War I, which gets a lot more of the attention, but it actually killed more people than World War I, technically. First wave was normal. Second wave was much more deadly. It basically mutated in Europe. It came actually from Kentucky, so maybe we should call it Kentucky flu. First wave broke out in Europe, and then U.S. soldiers brought it back as they were returning from World War I, and then it spread rapidly throughout the U.S. All right, Max and Joy, or
Yeah, so in France, England, and the US, reporters weren't allowed to document anything that could hurt the war effort. So keeping the disease that was like spreading throughout the war, throughout the troops was like a secret and everything.
The people that were primarily like commenting on the disease and letting others know were Spanish reporters, which gave it the name Spanish flu.
The flu mutated in Europe, and the mutated strain was deadly to healthy, like young, like people. So like especially people in the like troops and stuff, like soldiers.
And then the second wave began in August 1918, and the movement of soldiers around the globe was a pretty big role in spreading the disease.
Yeah. Yeah. So the movement of men, material and like a lot of the like crowded like conditions and stuff. So like I guess hospitals after they got really crowded, it kind of made it a lot worse.
nice, good. Yeah, super unusual that it was killing young, healthy men, especially in the military. Okay, Zach or Tammy?
Tammy, you there?
Sorry, my bad.
Okay.
So basically, it affected like super old people and super young people, kind of like COVID. But unlike COVID, it also affected like kind of people in like 25 to 35 in like the healthy region normally. The death was pretty bad. It was like blistering fevers, nasal hemorrhaging, pneumonia, and like your lungs would fill with fluid.
Yeah, this was caused by a cytokine explosion. So the immune system would send messenger proteins called cytokines to promote helpful inflammation, but the H1N1 strain triggers an immune overreaction, causing severe damage, severe inflammation, and fatal buildup of fluid in lungs. So like a lot of other diseases, it's people who are old and young are very susceptible because their immune systems aren't as strong. However, with this particular disease, it was all people with the healthiest immune systems were also susceptible because their immune system would have an overreaction. So if your immune system was really strong or it was really weak, you weren't safe either way. and the lung damage caused by this was akin to the effects of chemical warfare. If you can look, it looks like a burnt steak almost. It's just, it's pretty bad.
Crazy.
So there was like a lack of quarantines during this pandemic because the governments were more focused on World War One, which was going on. So there was like a refusal to quarantine. They needed workers in the factories to support the war effort. And not only were people still moving around, but there was also a shortage of nurses because many of them were deployed to in the war. And something else that did not help the war effort is that the American Red Cross refused to train African American nurses, which also it only worsened the nursing shortage.
Yeah, my understanding too is that they actually did have some very skilled African American nurses, and they didn't take advantage of using them. So nice. Okay, Jackson or Gabby?
Okay, so first off on the key points, medical science simply didn't have the tools to develop a vaccine for the virus. Second, millions of dollars were wasted in state-of-the-art labs to develop techniques for testing, treating this deadly first wave, which Harris describes as a huge distraction for medical science. And that deadly second wave passed by December 1918, but a third erupted in Australia, and eventually came all the way back to Europe and the US. So.
In April 1919, U.S. President Woodrow Wilson got the Spanish flu, and experienced really severe symptoms, but the White House covered it up by claiming it was a cold he had caught in the rainy weather in Paris during the peace negotiations. And this kind of derailed the peace talks a little bit, but he ended up making a full recovery. During the third wave, the mortality rate of the third wave was just as high as the second wave, but due to the fact that the war was over, there weren't the conditions to make to allow the virus to spread as easily as it did. So there were a lot less deaths attributed to the third wave.
Yeah, interesting. It really took advantage of the war to spread. All right, Anthony and Margot.
So there was this thing, false news or whatever, that aspirin, and this was propagated by the U.S. government, but that aspirin could help alleviate and help cure, quote unquote, the Spanish flu. So for a month or two period, October, November area, it was advised by the government to take 30 grams per day of aspirin, which is beyond a deadly dose, way beyond a deadly dose. I think I think the average now is something around 7 or 8, and not consistently. And so it created a pulmonary embolism and buildup of fluid, and helped either kill people faster who had the Spanish flu, or kill people who didn't necessarily need to die.
Yeah, if you look at that picture of your low dose aspirin, that's 81 milligrams, which is far less than 30 grams taken per day. And if you guys remember, we learned too earlier that there was also this aspirin poisoning. There was this weird condition that would develop with some, especially younger kids, that if they were given aspirin and also had the flu, there was this weird metabolism reaction, which actually was really bad for their brain. Okay, Sophia or Rory?
The flu had a pretty heavy toll on the economy because many businesses were forced to shut down because so many employees were sick, which kind of affected basic services such as mail delivery and garbage collection, since so many employees were sick. And then in other places, there weren't enough farmers to harvest crops. And then it also had a pretty heavy toll on society because it wiped out many families and also left countless widows and orphans. And then on top of that, funeral parlors were completely overwhelmed and bodies began to pile up. So many people had to dig graves for their own family members.
Yeah, yeah, horrible. Nice graph that you found there. That's pretty interesting. Is anyone taking economics? Anyone know what DJIA stands for? Is that like Daily Job Index or something? Anyone have any ideas?
I looked it up and it said it was the Dow Jones.
Yeah, Dow
index.
Jones Industrial Average. Yes. I should have known that. Cool. Yeah. So wow, look at that. I mean, look at the very end. That's crazy. As deaths shot up, the economy tanked. Okay, William or Bella?
So different cities responded to the pandemic in different ways. There's a kind of a strong sentiment that we needed to kind of respect and care for the soldiers returning from World War I, which, while justified, also led to covering up the fact that the flu strain was brought back, or one of the strains. And so it was downplayed in the media because of this, and this led to big parades being held, which acted as super spreader events. And that ended up resulting in 15,000 people dying by March of 1919. St. Louis, on the other hand, shut down public gatherings and ended up with 1/8 of the death rate. And similar to Milan in the bubonic plague, their results of death rates were very different from the rest of America or Europe. And then San Francisco didn't have much on how the city itself responded, but kind of gauge it through the fact that there was $77 fines for people caught in public without wearing masks. So they probably were closer to St. Louis in responding than Philadelphia.
Nice. Yeah, in the earlier part of the article too, they have some weird thing about how even like the Boy Scouts and stuff and these other groups got involved in like enforcing cleanliness and stuff. So yeah, and unfortunately, this wasn't due to a vaccine or anything. The pandemic came to an end because it's the RE, which I'm trying to remember now, was the R. Now forgetting what the E stood for, but again, it had basically either infected everyone, and so people were either dead or resistant to it, and so it was unable to spread any further. They found in 2008 that one reason, in addition to what Zach was saying about how it basically shot the immune system into overdrive, it also really made people, even young people, prone to getting pneumonia, and so that's why again you had the fluid build up in the lungs. People were basically drowning in their own blood, in their own lungs. So there's been a couple other pandemics: 1957, 1968, and 2009. Swine flu, if anyone remembers that. I was in the Peace Corps when that happened, and they actually called us all in to get the vaccine for it. And so COVID-19 is obviously very different from the flu. It's a little more severe as a pandemic because people can be asymptomatic, which isn't necessarily true for the flu. It's pretty clear when you have the flu, whereas COVID-19 seems to be able to sort of hide itself in some people who can then unintentionally spread it. And again, this is often called the forgotten pandemic because it was overshadowed by World War I. All right, good job, everybody. Questions or comments on that? So the question I want to throw out to you now is, what similarities do you notice about how the U.S. responded to Spanish flu in the world, and how the U.S. and the world is now responding to COVID-19? Anyone notice any similarities?
It was kind of downplayed by the leaders of the country.
Yes, a lot of denial at the start. Zach?
We're not very good at it. Like, just most people historically in America haven't been following quarantines and stuff like that.
Yep. Again, pandemic fatigue is striking, right? Especially now the holidays, people are having gatherings and stuff just because they want to, and they're sick of trying to isolate. Did anyone, William?
Well, in terms of public response, both pandemics, once mask mandates came in, kind of spawned anti-maskers.
Yeah, Yep. Yeah. And I feel like with vaccinations, you'll see a similar response. But yeah, it is fascinating seeing those old photos of people wearing masks around. It's exactly what we're seeing again now. So anyone see those harrowing images when New York got hit really hard? They had the morgue freezer trucks parked outside the hospitals. And again, this reference to body buildup. It's a horrifying thing to think about, but it's something that, most hospitals aren't ready for this kind of thing when these pandemics happen. That could be pretty horrifying. So that's something that struck me too, is sort of history repeating itself a little bit. Anything else? Well, the one thing you can be reassured by is the Spanish flu came to an end and there hasn't been any other resurgence. And so hopefully that is exactly what COVID-19 will do as well. So we just got to give it time and be cautious. All right, our last disease in history that I want to talk about today is we're going to move on to malaria, which is a disease I have had. And it's no fun, I will tell you. But I created a Nearpod, which is another one of these. It's sort of like Edpuzzle for slides, and I'm going to try the self-paced one. So on tasks to complete step number 5, malaria, there's a little link that says malaria and prophylaxis drugs Nearpod. It'll take you to another assignment page, and then you can click on the link there. It should ask you for a join code. I included the join code in the text there, and then you should just be able to read through the slides, and you'll hit a couple little question pockets at some point. There's about 24 slides total that includes the questions. So, just go through it, just read, and you don't have to go super slow or take notes, just read things over and go through. I'm going to grade for completion, not for correctness. So just take your best guess on the questions. If you can't get the Nearpod to work, I have the slides themselves available down below. And then there's the same questions in a Google form. So you can work through that if you need to. So I'm going to throw 15 minutes on the clock and see how far we get. And then we'll come back together to kind of check in. So 15 minutes to work through this. Go for it. Let me know if you need help or if something isn't working for you. This is the first time I've used the self-paced version. It's kind of simple, but it is really hard. But if you could just get mosquito nets out, bug repellent, that kind of thing, you can severely reduce the numbers, especially for children, if you just get them to sleep under a mosquito net at night. So yeah, here I am in the Peace Corps, like 40 pounds lighter. But I was in the Gambia and West Africa for 3 years, and yeah, I took Lariam. Peace Corps was super strict about it. If they ever found out that you weren't taking your medication, if you have malaria, they would kick you out. They were pretty strict. I had this crazy medical kit you can see me sorting through here. And yeah, I had this mosquito net that I slept under every night. And yeah, I slept outside because it was so hot most of the time. And it looks like most of you would be willing to roll out this genetic engineering. If we've got time, we'll watch a little bit more of it. Probably won't have enough time to really touch on it. Anyway, and then the sickle cell anemia stuff I find fascinating, that it's so crazy that a genetic disorder basically now gives an advantage. And so the correct answer was indeed C, that why does the sickle cell gene, why is it more common amongst Africans and people of African descent? And it's because it provided them with resistance to malaria. And so children who survived childhood malaria typically had this gene and then passed it on. Any questions or comments on that? All right, let's try a couple poll questions just to see how we're feeling. 3 questions for you to answer right now that should be up on the screen. First one was, why were Nobel Prizes in medicine awarded to almost every major researcher and discoverer who worked on malaria? And then some opinion questions after that, just 2 of them. All right, seeing 13 responses out of 14. Go ahead and end it, share the results. So here we go. Most of you were right that, yeah, the reason why Nobel Prizes were awarded was, and again, you don't hear about it very often, but this is technically one of the leading causes of death amongst humans. Malaria has been plaguing us for a very long time, and so any medical progress against it, and it's fascinating to know how recently a lot of this was discovered, that they didn't even realize mosquitoes were spreading it. I really find the name fascinating, malaria, right? Italians used to think it was because you were breathing in bad air when you were near bogs and things like that. But bogs are where mosquitoes breed, and so mosquitoes were really abundant in those areas. They just never put two and two together. Looks like all of you would be willing to donate to something like Against Malaria. Actually, I have a link to their website. They actually just started up right when I was joining the Peace Corps, and they've done some amazing work. They basically just donate mosquito nets. They treat mosquito nets with insect repellents and things like that, and just provide them to rural communities, and they've made a big difference. And yeah, knowing so interesting kind of divide here about whether prophylaxis should be required for soldiers and aid workers and things like that. So again, as I mentioned with Peace Corps, they were really strict about it. You had to take malaria prophylaxis while you were in country, or else it was kind of considered like self-endangerment. So I didn't get malaria while I was in the Peace Corps. My father worked for the United Nations, so I was actually born in Africa. I lived in Africa until I was 10 years old. I got malaria when I was apparently less than a year old. If I can convince my mom, I might have her come join our class and do a little interview about her experiences with that. They were living in rural Zambia. She apparently took me to a farm vet to check me. So sounds crazy, but anyway, I have no memory of any of this. I was a little baby, so. But I was not able to donate blood when I was in high school. I remember there was a survey beforehand. One of them was, "Have you had malaria?" I checked that box, and they didn't want it. I think I'm clear of it now. Like I don't think I'm not gonna have a relapse or anything like that. It's been decades since I last had a case. So, all right, there was a video that I had at the very end. It's about 7 minutes long, and it goes into a little bit more detail. It's a good review of malaria, but it goes in detail about how this gene drive and how using CRISPR-Cas9 to basically knock out a gene in these Anopheles mosquitoes could literally stop them from carrying the Plasmodium. And so there's still this ethical debate going on about, because we're essentially changing a species. And so it's something that, should we do it, should we not? Again, it looked like most of the class, you felt like, okay, yes, we can roll this out, but there's some trepidation. And so I'm relieved to see that they have been sort of like taking their time and experimenting more with it and seeing if this would work. But as far as I know, they have been rolling it out in some places. And so we'll see. Maybe hopefully malaria will be a thing of the past. All right, kiddos, we have our last class on Friday. Does anyone know what's happening on Friday?
Do we have the test?
We have a test. This will be our Unit 4 test. Just like before, it's going to be open notes, no time limit or anything like that. I have a study guide and review slides that are available right now on the end of the task to complete list, and they'll also be in the homework announcement and things like that. So you can use those to prepare, and you can look at them while you're taking the test. Questions on that at all? All right, that's it for me, kids. Thank you very much. Have a good rest of your evening.
Thank you.